There are a variety of risk factors for revision that have been identified, but one of them that comes up over and over again is race. So the reason we did this study was to ask the question, what is really the underlying risk? In a quick overview, not controlling for other variables, Blacks were at about a 60% higher risk for revision surgery. But then when we controlled for lots of other variables, that risk melted away. One of the reasons we think that there may not really be this racial disparity is that all of the patients had their surgery here at HSS. And it's possible that one of the reasons that we do see racial disparities is that Black patients may be guided to or choose hospitals that are either lower volume or don't have the same experience with joint replacements. When patients all have their surgery at a high volume hospital like HSS, there are no longer racial disparities, and what we see is simply that young age, male gender, and a constrained prosthesis are the only risk factors that we found predictive of knee replacement revision.